Let's talk about what puts you at risk of an injury. Prevention of sports-related injuries must be a priority for everyone involved in an organized sports, particularly coaches, officials, administrators, sports medicine personnel, athletes, and their parents. So we want to try to minimize these. Every effort should be made to reduce the likelihood of an injury. The following risk factors for injury will be classified as either an intrinsic factor or extrinsic factor. So we want to control these as best we can. Intrinsic factors, things within you that you can control. Or maybe you can't control, but things within you, as you as the individual, your age, your gender may put you more at risk, your body size, medical or injury history. If you've had previous knee injuries, you may be more susceptible to another injury if that medical history has been there, or what's happened to you in the past. Fitness level. If you don't have good fitness, you could get hurt, so you want to be at a good fitness level. But fitness level is something that you can control. Muscular strength and flexibility. Things within you. Skill level. Psychological state. And we kind of talked about this. If you're not in a good psychological state or you're scared, it could put you more at risk of an injury. It's his individual intrinsic factors. Extrinsic factors outside of your control. Equipment. You can't control what equipment you get. The environment. You can't control the weather. Playing surface. Don't have a lot of control over that either. The type of activity. You don't have control over how football is played or how the game is played or how basketball is played. High-risk sports, be the type of activity. Conditioning errors, things that the coach doesn't teach you well or get you conditioned right. Here's another extrinsic factor. We talk about the environment. How about a lightning storm? Prevention of athletic injuries. Intrinsic injury factors I can't even speak today. Intrinsic injury factors risk reduction methods. Number one, the following steps are successful intervention strategies designed to prevent sports injury. Athletes in high-risk sports must be educated about inherent hazard and intrinsic risk. We've got to teach you about things that could happen in your sport. Participate in strength and conditioning programs that are guided by certified strength and conditioning specialists, or at least a coach who knows enough about weight training to get you in the right shape for your sport. I know girls think that they're going to get huge and bulky, and that's not the truth. They still need to lift weights, maybe more at a less percentage than guys, but they still need to lift weights and get bigger, faster, stronger. Follow guidelines for sports physicals set forth by the UIL or other governing body. This aids in finding out if an intrinsic problem exists before an athlete even steps out on the field. For the best outcomes, follow these models. Let me step back just a second. We need to find out if there's something in the past that could hurt you in the long run. If you've had previous concussions, previous knee injuries, eyesight problems that could cause you further harm down the road because you can't see well even. But for the best outcomes, follow these models. A pre-participation physical exam, a PPE, is required upon entrance into athletic program and must be renewed each 2 years. At Wiley, we renew it every year. Primary purpose is to identify pre-existing injury risk factors or pre-existing injuries or diseases. Physical exams can identify spina bifida occulta, absence of one of paired organs, postural problems, muscle imbalances, high blood pressure, cardiac defects, or arrhythmias, allergies, vision deficits, previous injuries, and skin infections. 2 forms of PPEs. Office-based works well when physician is familiar with the athlete's medical history. So if you go to your family doctor and they know you more personally. Or the coordinated team approaches, which is a station-based screening and is used for examining groups of athletes and is highly effective. This does work because you have several doctors checking several things, so it's not just an in and out, run you through the mill. They're checking for things, and maybe a specific thing at each station, so they're more careful to find those things that could be wrong. It must include comprehensive medical history, height, weight, vision, skin, abdominal, genital, and cardiovascular screenings. Identify any pre-existing conditions that may make the athlete vulnerable to specific medical problems. For example, sickle cell trait, diabetes, epilepsy, and drug allergies. Absence of parent organ, example, eyes, kidneys. It is a complex issue and a number of variables must be considered, including the relative risk associated with a particular sport. All information should be handled appropriately to protect the athlete's confidentiality. So it's not something we go talk about with everybody in the world. We talk about it between the doctor, the trainer, and their coach. That's it. And the parent, I shouldn't say, and the parent also. As extrinsic injury factors, risk reduction methods. Coaches and athletic trainers must monitor these factors. Practice and competition, environmental conditions, especially heat and humidity, must be assessed. When it's too hot and humid, we have to give you more breaks, get you more water, try to get you more conditioned to that outdoor. We don't just throw you out in and go. Because we could have somebody pass out and die from the heat. Indoor and outdoor facilities must be designed, maintained, and frequently inspected for safety. We got to check for those things that could hurt you on the field. Even if it is a piece of gravel on the field, that could hurt you. We have to get those things off the field. Protective equipment, we have to make sure it works right. To aid you in finding out if lightning is too close for safe participation in outside sporting events, utilize the flash to bang method. This is important. How it is done. When you see the flash of the lightning, start measuring time in seconds until you hear the bang. Each second is 0.2 miles, so if you count off less than 30 seconds, get inside. Not the best thing, but it does work if you don't have a lightning detector.